Hello everyone, my name is Deepa Bajetha. I am working as an associate professor in IIMT College of Pharmacy. Today I am going to discuss about the topic acidifiers, antacids, cathartics and antimicrobials. So in which I will cover the content. First is acidifiers, antacids, cathartics, antimicrobials. The digestive system is the gastrointestinal tract, which is a group of organs. It extends from alimentary canal to the anus. The entrance of the system is the buccal cavity, that is mouth. The GIT system, which is divided into two parts. First one is stomach, small intestine, and second one is large intestine. Stomach, small intestine is further divided into small group of organs, that is duodenum, jejunum, ileum. Large intestine is further divided into small group of organs like ascending colons, transverse colon, descending colon, rectum with the exit anus. So first one is stomach. In stomach, digestion of proteins in acidic medium takes place with enzyme called pepsin. Both HCl, hydrochloric acid, and enzymes are secreted in the stomach by specialized cells. And in small intestine, the following changes takes place like digestion of protein and digestion of carbohydrates. Digestion of proteins takes place in alkaline medium in the presence of enzymes, and digestion of carbohydrate and lipids also take place in small intestine with the help of enzymes and bile salts. And also absorption of digestion foods also takes place in small intestine. Next is ease of GIT. Inadequate secretion of acid takes place in the stomach, cause achlorhydria, or we can say that hypochlorhydria. When excess secretion of acid takes place in stomach, causes hyperacidity or hyperchlorhydria. There may occur inadequate absorption of fluids and minerals from large intestine, thereby causing diarrhea. And other conditions are like there may occur insufficient peristaltic movement of large intestine, thereby causing constipations. There may occur inadequate secretion of saliva, thereby making the food to swallow with difficulty. So these are the agents in GIT tract. Like first one is acidifying agents or acidifiers. In acidifying agents or acidifiers, first one is gastric acidifiers, and example include in this hydrochloric acid. Second is urinary acidifiers. Third one is systemic acidifiers, and last one is acids. And in antacids is divided into two categories. First one is systemic antacids, that is absorbable antacids, and second one is non-systemic antacids like non-absorbable antacids. And aluminum containing antacids and calcium containing antacids. The examples include in aluminum containing antacids like aluminum hydroxide, aluminum phosphate, and in calcium containing antacids, example calcium containing antacids and tribasic calcium phosphate. And C, magnesium containing antacids, example magnesium carbonate, magnesium hydroxide, and combination antacid preparation in which we add two antacids. First is aluminum hydroxide gel combined with the magnesium hydroxide, aluminum hydroxide gel, and magnesium trisilicate. C category, it is protective and adsorbents. Bismuth compounds, subcarbonate, and bismuth subnitrate. And last one category in GIT agents are cathartics. Cathartics is further divided into four categories, in which first one is stimulants, example senna, rhubarb, cascara, castor oil, etc. Second one is bulk purgatives, example methyl cellulose, sodium carboxymethyl cellulose, gum, isabgol, etc. Lubricants and saline cathartics. So we start with the acidifiers. These are the inorganic chemical substances that either produce or increase acids. These chemicals increase the level of acid in the stomach. First one is gastric acidifiers. In gastric acidifiers, these are the drugs which are used to increase acidity of stomach in patients suffering from achlorhydria or a hypochlorhydria. And in urinary acidifiers, these are the drugs mainly used to remove excess acid in urine from the body or maintain the pH of urine. Systemic acidifiers. These are the drugs which are able to neutralize alkaline body fluids, especially blood, or to maintain pH of all parts of the body. So first one is hydrochloric acid in acidifiers. And in hydrochloric acid having molecular weight 36.46, molecular formula is HCl, and synonyms, the another name of hydrochloric acid is spirit of salt. Preparation, how we can prepare this hydrochloric acid? So we can prepare with the sulfuric acid and sodium chloride. When we treat sodium chloride with sulfuric acid by passing the liberated hydrogen chloride through water, it will give hydrochloric acid. Properties: it is nearly colorless, clear, and fuming liquid. It possesses pungent odor. It is soluble with water and alcohol. It is strong acid and attacks metals, forming the hydrochlorides with the evolution of gas. And chemical properties. In chemical properties, when we treat hydrochloric acid with sodium metal, which result in the formation of sodium chloride and liberates hydrogen gas. And second, when we treat hydrochloric acid with strong oxidizing agent KMNO4, it liberates potassium chloride, manganese chloride, water, and Cl2, chlorine gas. It is stored in well-closed container. What is the storage of these hydrochloric acid? It is stored in well-closed container of glass or other inert material at temperature not exceeding 30 degrees Celsius. Use. It is used as a pharmaceutical aid or as an acidifying agent. Used as gastric acidifiers when level of hydrochloric acid in the gastric juice are low. Externally used as a solvent, catalyst in biopharmaceuticals as acidifiers. Dose is 0.6 to 8 ml. These are the drug preparations which neutralize excess HCl in the body. What is antacids? Antacids are usually alkaline substances, and it is given to the patient suffering from the hyperchlorhydria. Those patients having high antacids in stomach suffer from hyperacidity. It is known that the production of gastric hydrochloric acid in the continual process. It means that administration of antacid is also a continual process. Under the normal physiological condition, hydrochloric acid is secreted by epithelial cells of gastric mucosa. The pH of stomach depends upon the intake of food. If antacids are water soluble, may produce systemic alkalosis because of absorbable ions disturbing acid-base balance of body fluids. Depending upon the location, ulcers can be classified Esophageal ulcer affects esophagus, gastric ulcer affects gastric mucosa, and duodenal ulcer affects duodenum. So we can classify antacid into two categories. First one is absorbable antacids, systemic antacids. These are the water soluble causing alkalosis. Example, sodium bicarbonate. Second one is non-systemic, that is non-absorbable antacids. These are not absorbed to significant extent. This group is further divided into following. Non-systemic antacids. First one is aluminum containing antacids. Example, sodium carbonate, aluminum hydroxide. And calcium containing antacids. Example, calcium carbonate. And magnesium containing antacids. Example, magnesium carbonate. And when we combine two antacids together, that is combination antacid preparations, in which example is aluminum hydroxide gel and magnesium hydroxide and aluminum hydroxide gel and magnesium trisilicate. So what is the ideal requirements for the antacids are the antacid should be absorbable or cause systemic alkalosis. The antacid should not be laxative or cause constipation. The antacid should exert its effect rapidly and over a long period of time. The antacid should probably inhibit pepsin. The antacid should have buffer in the pH range of 4 to 6. The reaction of the antacid with gastric hydrochloric acid should not cause a large evolution of the acid. These are the marketed antacid preparations, brand name, Digene, in which aluminum hydroxide and magnesium hydroxide, Kogel, Sol acid. These are the marketed anti-acid preparation with brand name and their ingredients. So first one is antacid is sodium bicarbonate. Chemical formula of this sodium bicarbonate is NaHCO3, molecular weight 84.01, and the common name is sodium hydrogen carbonate, synonym baking soda or meetha soda. Preparation is industrial scale. We can prepare this antacid by the help of solvay process, in which brine solution is saturated with ammonia to remove impurities. Solution is filtered and passed through carbonating tower and allowed to cool to enhance precipitate. NaCO3 is less soluble in water below 15 degrees Celsius. The precipitate is dried, filtered and dried. Water with carbon dioxide, it will give carbonic acid. Then carbonic acid further treated with ammonia, it will give ammonia carbonate. Then ammonium carbonate is further treated with sodium chloride, it will give sodium bicarbonate with ammonium chloride. And on lab scale, we can prepare this sodium bicarbonate with prepared by passing through CO2 gas through the solution of NaOH solution is contained to obtain the product. Color is white, nature is amorphous, taste saline, solubility soluble in water and insoluble in alcohol. Incompatibility, it inhibits the absorption of tetracycline from the GIT tract. Storage, it should be stored in well-closed container. Uses, sodium bicarbonate was used as an antacid to reduce excessive acidity of the gastric juice. Sharp increase in the gastric pH 7 neutralize HCl but result in the production of CO2 causing bleaching and fluctuance is not desirable. Next is cathartics. Cathartics, these are the drugs which bring about defecation. They are beneficial in the constipation and for expulsion of intestinal parasites. In normal habits, peristalsis cause defecation. The peristaltic waves are able to stimulate bowel and relieve its contents. The peristaltic motion normally takes place about 3 to 4 times a day. Constipation can also be due to many factors like weakness of intestine, intestinal spasm, injury, or use of certain drugs and diets. In constipation, fecal material become dry and hard, so we can use cathartics or purgatives for the relief constipation. So that is cathartics, in which stimulants, lubricants, saline cathartics, and bulk purgatives are included. So what is stimulants? Mainly, these drugs are act by local irritation on the intestinal tract and bring about stimulation of peristaltic activity, as they are directly act on intestine and stimulate peristalsis, so they are termed as a stimulants. Examples: senna, castor oil, rhubarb, etc. And next is bulk purgative. Bulk purgative means these are the basically agents which are able to increase bulk of intestinal content. So these are the soluble or non-digestible type of materials. Example: methyl cellulose, sodium carboxymethyl cellulose, gum. Next is lubricants. In constipation condition, the content of intestine become hard and not easily removed from our body. So because of absorption of water by body, the result in the difficulty in clearing bowels. Example: liquid paraffin, glycerin, etc. And saline cathartics, in this acts by increasing the osmotic load of intestine by absorbing large quantity of water and thereby stimulate peristalsis. Poorly absorbable cations like calcium, magnesium, and anions like phosphate, sulfate, tartrate are contributing to this effect. Saline cathartics are water soluble and they are taken with plenty of water. So this is helpful in restricting excessive loss of body fluid and reduce nausea and vomiting. They may be administered by oral route in the form of suspension, tablet, or in the suitable formulations. Example like magnesium hydroxide, magnesium sulfate, tartrate salt of sodium and potassium. Next is protectives, protective and adsorbents. So protective and adsorbents are chemically inert substances which are used in the treatment of diarrhea. And diarrhea, what is diarrhea? Diarrhea is basically defined as a frequent passage of watery stool or liquid feces as a result of increased motility in the colon. The stool may contain blood, pus, mucus, or excess quantity of fats. It may be mild or chronic diarrhea. So what is mild diarrhea? Mild means due to the bacterial infection with their toxins. Side effect of some drugs: hypersensitivity, accidental or intestinal poisoning. While chronic diarrhea is due to GIT disturbances, absorption and inflammation. They are the small basic difference. Mild diarrhea means due to bacterial infections and chronic diarrhea due to GIT disturbance. So excess discharge of intestinal contents lead to the loss of electrolyte, which give rise to dehydration or electrolyte imbalance. Example of protectives and adsorbents are bismuth, subcarbonate, kaolin, and bentonite. So next is antimicrobial agents. Antimicrobial agents are like disinfectant, antiseptic, is a substance that kills or inhibits the growth of microorganisms such as bacteria, fungi, and protozoa. Antimicrobial agents either kill microbes, that is microcidal, or prevents the growth of microbes, that is microbiostatic. So we can classify antimicrobials into 5 categories. Like first one is antiseptics, disinfectants, germicides, bacteriostatics, and sanitizers. So first one is antiseptic, and examples are Dettol. These are the substances that are able to kill or prevent the growth of microorganisms. It acts by inhibiting their activity or destroying them, especially by applying to the living tissues like surface of skin, application of antiseptic dressing on wounds. These drugs like phenol, iodine, boric acid, cetrimide are the example of antiseptics. Disinfectant. These are the substances that are used to prevent growth or multiplication of microorganisms. It is used to apply on inanimate objects, non-living objects. Disinfectants are widely used for home and hospital sanitation. All disinfectant solutions undergo deterioration under storage and elevated temperature. Example, cresol and phenol. Next one is germicides. These are the substance which kills microorganisms. Specific terminology like bactericide against bacteria and fungicide against fungi and virucide against virus denotes exact action. Bacteriostatic, these are the substance which inhibit the growth of bacteria. Bacteriostatic drugs or agents do not kill but arrest the growth of bacteria. Sanitizers, disinfectants that are used to maintain general public health standards, termed as sanitizers. Sanitation is mainly concerned with cleaning or washing away the organic matter, example saliva and mucus. Sanitation can be achieved only with surface and articles that are physically clean, and high concentration of sanitizers also cause local cellular damage. So what is the characteristic of antimicrobial agents? So antimicrobial agents should possess antiseptic and germicide activity, and it also have rapid onset of action. It should not cause local cell damage when we use antimicrobial agents. It should not interfere with body defense mechanism. It show no systemic toxicity from topical applications. So example in the antimicrobial agent is iodine. The chemical formula of iodine is I2 and molecular weight is 126.9. Iodine compounds are very common in nature. Seawater is also having the traces of combined iodine which gets absorbed by some specific plants and seaweeds like Laminaria digitata. Iodine also occurs in the form of sodium iodate. How we can prepare this? So it is manufactured by extracting kelp, that is seaweed ash, with water, and the sulfate and chloride of sodium and potassium gel crystallized out. The solution is concentrated, leaving freely soluble sodium and potassium iodide in the mother liquor. Sulfuric acid is added to mother liquor, small amount of thiosulfate added and allowed to settle down. So mother liquor is decanted and to this manganese oxide is added and iodine distills over. So various type of iodine preparations are like aqueous iodine solution, weak iodine solution, strong iodine solution, povidone iodine solution, and tincture of iodine. So first one is aqueous iodine solution. In aqueous iodine solution, it is having 5% weight by volume of iodine and 10% weight by volume of potassium iodide in purified water. The composition of this iodine preparation is we can add 50 gram of iodine and 100 gram of potassium iodide and 1000 ml of purified water to make aqueous iodine preparation. And weak iodine preparation, synonym is tincture of iodine. It is having 2% weight by volume of iodine and 2.5% weight by volume of potassium iodide. The compositions are iodine we can add 20 gram, 25 gram add potassium iodide and 1000 ml alcohol. So example in antimicrobial agent is hydrogen peroxide. Chemical formula is H2O2. It is an aqueous preparation of hydrogen peroxide. Method of preparation. So we can prepare this by adding barium peroxide with sulfuric acid and form barium sulfate with hydrogen peroxide in the presence of ice cold dilute sulfuric acid. So properties are it is colorless, odorless, liquid having slightly acidic taste, it is strong oxidizing agent. The solution decompose in contact with oxidizable matter or when made alkaline. Uses it is a strong oxidizing agent and it gives nascent oxygen. It is used also as a cleaning cuts and wounds as an antiseptic and germicide. It is used as deodorant. It is also used in the bleaching the hair, effective antidotes in phosphorus and cyanide poisoning. Thank you.